Who would imagine that getting one of these little things out of your body could be more painful than having a baby? Yet it's true. It's a kidney stone, a mineral-based concretion that can form in our kidneys when we have a chemical imbalance in our urine. So who can get a kidney stone and what can cause them to form?
Just about anybody can get kidney stones. People who have a family history are more likely to get them than someone who doesn't, but that doesn't mean you have to have a family history to get them. The most likely people that would get kidney stones are people that are likely to get dehydrated. So people who are working or doing things outside and not getting enough to drink, because dehydration leads to concentrated urine, and that can lead to kidney stone formation. The earlier you get a kidney stone, your first kidney stone, the more likely you are to have more stones in the future. So if we see patients who are quite young, in their teens or 20s when they have a kidney stone, it's very likely they'll have more stones in the future. And that's why we may be more likely to add medications to try to prevent that, since there's so many years ahead where they can develop a stone. If someone's in their 50s or 60s and develops their first stone, it's possible they may not get a stone in their lifetime. And both men and women can get kidney stones. It's not something that's unique to either of the sexes.
If getting and passing a stone is so unpleasant, what can we do to reduce the risk of forming these kidney stones in the first place?
The best way to prevent kidney stones is to drink plenty of fluids, especially if you're outside in the summer or when it's hot, or if you're out working all day in the heat. Because dehydration, your body has a mechanism to hold back water and try to keep it, and that makes your urine become very concentrated. And it's just like chemistry class. As that urine becomes more concentrated, it's more likely to have the crystals start to form, and those crystals are what form into stones as time goes on.
All right, so you have a pain in your back that won't go away. How can a doctor determine if you've actually got a kidney stone causing the pain?
The first step is if someone's feeling pain and they're not sure what it is. In this day and age, what we do is we get some kind of x-ray, and usually that's a CT scan to really delineate, is this a stone or is it something else?
Aha, so let's say that the CT scan shows you've got a stone. Now, what are your options and which one best fits your condition?
So again, depending on the size and location of the stone, there's a lot of different options. For small stones, stones that are less than 4 or 5 millimeters, one option is to try to pass a stone. And many times we'll give people medications for pain, as well as there are some medications that help dilate the urinary tract so the stones may pass more easily, so we may start with that. If the stone is not likely to pass on its own, or someone has pain that's just not getting better, then the options include using a scope to go up through the urinary tract and go up to the stone and either take it out using a small basket or shoot it with a laser to break it up into pieces that'll fall out. That's called ureteroscopy. And that's an outpatient surgery. People bounce back from that pretty quickly. Another option is what's called shockwave lithotripsy, and many people have heard about this, where we don't have to put anything up into the body. We just use an x-ray to localize the stone, and then they lay on a specially designed table that shoots shock waves up into the stone to break it into pieces so they pass.
It's logical, the bigger the stone, the greater the need for medical intervention. At what point does stone location or stone size require some form of surgery?
For bigger stones, stones that get to be 15 or 20 millimeters in diameter, those approaches aren't as effective because you have to break them into so many pieces to get them out. Although there's new studies showing people doing bigger and bigger stones with scopes and things. But in order to get the stones out with the most reliable approach, sometimes what we'll do is make a small hole in their back and go through the back with a little bit bigger scope and take the stone out that way. That requires a stay in the hospital, usually of a day or two.
It makes sense if 85% of kidney stones are made up of calcium compounds. Cutting calcium from our diet would then help reduce the risk of stones, right? But what does the research say?
Studies show that increasing calcium intake does not increase your kidney stone risk. And in fact, for some people, it increases the risk of other problems like osteoporosis. So we try to not tell people reduce your calcium intake. But for people who are prone to having stones, some of those foods that they can avoid are things that have oxalate in them, which is another component of stones, and that's things like nuts and chocolate and spinach and rhubarb. So if somebody's eating a lot of those things, taking those out of their diet can help.
No matter what their size, kidney stones can become much more than a big pain. So it makes healthy sense to drink plenty of water, especially drinks containing citrate or citric acid, such as lemonade. And if you produce reoccurring kidney stones, you may want to consult your urologist about other dietary changes to reduce oxalate in your diet. Or they may consider prescriptions that can help prevent forming these little things that can cause big pain and sometimes even surgery.